am on so many medications that are treatments of symptoms. I'm on Austedo for my movements. I am on Wellbutrin for my depression. I am on insulin for my diabetes, but there is nothing for me that can help with my sharpness. I slowly feel my cognition slipping away. Are there any medications to help specifically with the way my brain is slowing down? Even if it isn't for people with HD, I am open to trying anything that will help.
So this is a really common question. Unfortunately, there aren't any approved medications to treat the cognitive issues in HD. So the slowness of processing, the difficulty with organizing thinking, the difficulty with planning and getting through steps of things. And then as the disease progresses, difficulty with remembering and recalling information and using it. As I mentioned before, when I was talking about apathy, some of the same things apply to the cognitive symptoms in terms of reviewing all the medications. So that's one of the first things I do with a patient who has cognitive complaints, reviewing all the medications, minimizing the medications that might be impacting cognition and possibly increasing something like Wellbutrin or bupropion, which is an activating antidepressant. Sometimes that will help people to feel a little more alert or a little sharper. There's some off-label use of medications that were approved for Alzheimer's disease. So there are medicines called cholinesterase inhibitors. Aricept or donepezil is probably the most widely recognized one of those, most widely used. Some people will try those off-label. I'm not terribly impressed with the effect of those, but it's something that if someone wants to try something for cognition, I think that is available. I encourage a lot of non-medication intervention as you're able to, getting outside and actually getting into the sunlight and the fresh air, because I know a lot of people stay indoors a lot, especially this time of year, but trying to get outside and get sunlight exposure, and then getting a little bit of safe exercise every day. So if you're able to walk a bit, maybe walk with a companion. The studies in normal aging are very clear that people who do a little bit of walking every day or a little bit of some kind of aerobic activity do better in terms of cognition than the people who don't. So we should all be doing this anyhow. If you're not able to walk safely, maybe having little hand weights and doing hand weight exercises, or sitting in a chair but stepping in place, or maybe having a seated exercise program that you do with a companion or with a video so that you can do it safely without falling. I think those are all things that can help you to attain your cognition. And then having contact with other people, trying to do things that are intellectually stimulating. So rather than watching television, reading a book, or listening to a book on tape if you're able to. So I think those interventions can be very helpful for some people. I think especially if you're at home and you're by yourself all day, the boredom and the lack of stimulation can sometimes make you feel more impaired than you are. I will say that I'm very happy to see Sage as one of our sponsors today, because they are doing a study on treatment of cognitive symptoms. So it's a research study. It's not an approved medication, but it's wonderful to have a sponsor that's taken an interest in cognitive symptoms.